Good morning, everyone. Can you imagine knowing exactly what you want to say but struggling to get the words out? Or feeling like your words are stuck, voice are stuck, unable to flow smoothly? These are challenges faced by people with aphasia and stuttering. But with the right therapy, they can retrain their speech and regain confidence. So today, let's explore two powerful techniques, which is speech language therapy (SLT) for aphasia and fluency shaping technique (FST) for stuttering. For aphasia, this condition, often caused by a stroke or injury brain, affects a person's ability to speak, understand, read, or write, but their intelligence remains intact. It's the connection to language that's been disrupted. So, how do we help them communicate again? That's where speech language therapy (SLT) comes in. So the therapy comes steps by step. The first step is word retrieval exercises. First, we help patients find the right words again. They practice naming objects, describing pictures, and using alternative words when they get stuck. For example, if they can't remember cup, imagine saying something you drink from. This strengthens their word recall skills. Second step is sentence formation. Once they can find words, the next step is forming sentences. They start simple with want coffee and gradually add more details like I want hot coffee in a blue mug. This helps rebuild language structure. The third step is conversational therapy. Now, speech therapy isn't just about practice, it's about real life communication. Patients engage with structured communication like ordering food or making small talk to regain confidence in everyday speaking situation. For the fourth step is reading and writing practice. Since aphasia also affects reading and writing, therapy includes simple reading exercises and short writing tasks to help them recognize words and express themselves better. The fifth step is non-verbal support. And if words don't come out, we teach alternative communication methods like gesture, pointing, or using assistive apps so they can still express their thoughts. With a patient and consistent therapy, aphasia patients can slowly regain their voice. For stuttering, now let's move to stuttering. People who stutter know exactly what they want to say, but their words don't come out smoothly. This can cause frustration and anxiety. That's where fluency shaping technique (FFT) helps. It trains them to speak more fluently step by step. Let's go down. First step is slowing down speech. First, we teach them to slow down their speech. Instead of rushing, they stretch out words slightly, giving their brain and mouth time to sync. This reduces tension and speech blocks. The second step is easy onset. Next, we practice gentle style. Instead of forcing words out like please, to ease into them, please. This prevents speech blocks and helps natural word flows. The third step is continuous phonation. Then we focus on keeping speech smooth by connecting words instead of stopping suddenly. Think of it as a continuous melody rather than choppy beats. It keeps the rhythm flowing. For the fourth step is breath control therapy. Breathing is a key. Many who stutter run out of air mid-sentence. So we train them to take deep breath, regulate airflow, and speak with a steady rhythm, just like pacing yourself while running. The fifth step is gradual progression. Finally, we build fluency step by step. They start with single words, move to phrases, then practice full conversations. The goal is to make fluency a habit, not just something they practice in therapy. With time, practice, and patience, FST helps people who stutter speak smoothly and with confidence. So, in summary, SLT helps aphasia patients rebuild communication while FST provide tools for stuttering individuals to speak fluently. With the right therapy, anyone can improve their speech and regain confidence. I think that's all. Thank you for your time.